Hey everyone, Dr. Jeff Crockett here with Utah Spinal Works, coming at you from Highland, Utah. Happy New Year again, and this month, we're gonna be talking all about your back pain. So, new year, new plan. This week, we're gonna be talking about maybe how you can get your back pain under control. So this video is kind of for everyone who has tried everything in the past. If you've tried chiropractic, physical therapy, if you've gotten injections, consulted with surgery, right? And that's kind of something you're considering. Listen up, because we're going to go over this new plan. We're going to go over our decompression protocol. It helps 90% of our patients get about 70% better. So let's dive right in and get into it. Okay, so let's talk about the plan a little bit. So the plan kind of includes a little bit of everything. We do chiropractic, we do decompression, we do red light therapy, nutrition, and we do exercises or rehab physical therapy kind of at home. So we piece all of that together because it helps. Like, doing it all together works. Okay, so when I say a decompression protocol or a decompression plan, it's not just the decompression table that we have here, but it's everything kind of combined together. So let's talk about each element, what it's going to do for your back, and how it's going to help you to be the best person you can be in 2024. First, we're going to talk about chiropractic adjustments. So we will do adjustments every visit here. Low back, mid back, neck, knees, whatever needs to be adjusted, we want to make sure that we get things moving. Essentially, your spinal cord innervates with nerves to the whole body, and if there's some restriction there, it's going to be messing up downstream, right? It can be causing some dis-ease. So we want to make sure that the spine's moving well, we want to make sure that the joints are moving well, and we're going to do that every single visit. And after that, we're going to do some decompression. So the decompression machine is here. It tips back and it stretches the spine. As it stretches the spine, it's going to bring fluid and nutrients into the disc, and it's going to restore that disc health. A lot of times patients just want to do just the decompression machine, and it helps, it does. But honestly, the adjustments with the decompression machine are going to help a lot more. We go further and we do some red light therapy, some focused red light therapy right over the area that is bothering you. So if it's sciatic, low back pain, pinched disc or pinched nerve, herniated disc, this is the protocol for you, right? So we'll do the adjustment first, warm up your back, get it ready for that spinal decompression, and then we'll do the red light, or we'll do the decompression, and then we'll do the red light therapy on that focus area. What the red light therapy does is it stimulates the mitochondria, so it works on a cellular level. It stimulates that mitochondria to produce more ATP, and essentially it decreases the inflammation in the area and increases, or it just improves healing. Okay, so that increased ATP will actually help with cellular healing. And then on top of that, we give you a detailed supplement list. So the supplements, essentially they work from the inside while we work from the outside, okay? So we're gonna help your body as a whole function more properly. If we're doing the supplements, we're doing the adjustments, the decompression, the red light therapy, ideally everything works together to get that 70% better result. On top of that, we send everyone home with a personalized and detailed rehabilitative exercises. So if we're focusing on the neck, we're going to send some focused neck things or neck exercises, and it's detailed for your condition. So somebody that has like a low back pain that's a herniated disc versus somebody that has like low back pain from let's say sciatic nerve, right, impingement or something like that. They're going to have two separate exercises, so it's not just a cookie cutter plan for every single patient. So those are kind of the 5 elements of our decompression protocol. You've got the adjustments, the decompression, red light therapy, nutrition, and the exercises. And they all work together to help you, the patient, get better. So if you've had trouble in the past with your back pain, sciatic, herniated disc, bulging disc, you've tried physical therapy, you've tried injections, maybe you've gotten a surgical consult, maybe even if you've tried decompression, right? We want to work together to do all of this. The protocol is those 5 things, but we're gonna do 30 visits, okay? So the protocol is based off of research done by a bunch of doctors. So I've developed it with a bunch of other doctors to really say, hey, 30 visits is gonna be what we need to do. The reason being is the research shows that 24 visits is your minimum effective dose. So minimum effective dose, meaning if we did 18 visits, we won't get an effective dose for that treatment, right? If we do 12, you might feel better, but you're not gonna get an effective dose. And typically what I see is within the first 8 visits, patients will often get worse because as we're working on it, we're breaking up that scar tissue. Your spine releases what's called noxious metabolites, and that causes inflammation in the body. So those first 8 visits, we're gonna release those noxious metabolites up to 8 visits. Sometimes it only lasts 1 or 2, 3, but up to 8 visits, we see kind of the patient will get worse. And then between 8 to 12, it's exponential, 12 to 24, exponential. And like I said, most of my patients get 70% better, with a lot of them getting up to 100% better with this protocol. So we'll do 24 visits. We like to do those really fast. So we'll start out 5 times a week. We'll go down to 4 times a week, and then we'll go down to 3 times a week until we hit that 24. And then we don't just want to drop you off from care and say, see you later. We want to make sure that the care sticks and that you're doing good and there's nothing that we have to adjust. So we see you once a week, we check in, we do the protocol that once a week for about 6 weeks, and that really gets a good baseline for maintenance. If you even have to come in anymore, most patients are good to go, right? They're coming in once a week, their pain's gone, their leg pain's gone, they're able to play pickleball again, they're able to play with their grandkids. So if this is something that sounds interesting to you, if you want to check it out, try our decompression protocol. So you can look us up online at utahspinalworks.com or give us a call at 801-770-4333, and we hope to help you this new year.